Okay.
Yes, just
Started. Okay, start.
yeah, we can start.
Relax, guys. Relax. The relaxation begins now. Okay, so good morning, everyone. So before we begin the presentation, we just wanted you to get in the zone. That's why we have the candle and we have the speaker because it has some relaxing music. So while you listen to our presentation, you can be calm and relaxed. So yeah, so we are presenting on relaxation-based therapy. So to begin with, what exactly is relaxation-based techniques or therapy? So relaxation-based techniques refer to a number of techniques that are designed to teach someone.
We're not able to see the
So relaxation-based techniques are basically designed techniques to teach someone to be able to relax voluntarily by reducing their muscle tension and anxiety. And it has been a part of psychotherapy for ages, but now it has recently been expanded to other environmental settings as contemporary techniques to treat stress, anxiety, PTSD, or even pain for that matter. So these techniques can include special breathing exercises or progressive muscle relaxations, and they are basically designed to reduce all your bodily sensations like lower your heartbeat, your blood pressure, or reduce the activity of your stress hormones for that. So whether your stress is spiraling out of control or you already have it tamed, it's always beneficial to learn a few relaxation techniques. So one such prominent relaxation technique is the body scanning method. So wherein basically you make the individual, make him aware of all the bodily sensations that are happening in a gradual sequence from his feet up to his head. And as in when he feels any stiffness or rigidity in the body, you ask the person to breathe through it or take few deep breaths and there is a balloon in their stomach, as in when you increase your breathing, the balloon is deflating or inflating inside your belly. So that's how you breathe in the body scanning method. So like body scanning method, there are various other relaxation techniques which me and my group will now present. So I'll hand over the mic to Porkode.
Hi, I'm Porkode and so we're all different types of learners, right? Like I'm a very visual learner, my friends are auditory, some are kinesthetic, they just have to write to memorize. Similarly, for relaxation as well, we might prefer specific senses over the other. How do we figure out which sense is very relaxing? We can do it using sensory profiling. This is an assessment in which we can understand what type of sense is the most relaxing and calming for people. Right now we don't have the time, but we have a resource compiled for you all. It has the Oxford sensory profile assessment. We will share the resources with you guys and you can test it out later.
the components.
Yeah, so it just has a couple of questions for each sense that you can answer and you can understand which is the best sense for you to relax. Now we'll move on to the actual technique. So this is aromatherapy. In the recent days, we've all heard the buzz around essential oils, right? So in aromatherapy, we will be using essential oils in the management of psychiatric conditions. So how is it administered? There are two dominant ways of administering it. One is you just put the essential oil in a diffuser. It will break it up into smaller molecules and diffuse it in the air. And the other method is to mix it with a carrier oil like coconut oil, jojoba oil or olive oil and then directly apply it on your skin. But this is not very effective for people who have very sensitive skin. How does it work? So this is the important part. So when we smell the essential oil, the olfactory nerve will carry it to the olfactory lobe and the olfactory bulb that will be directly connected to the hippocampus and amygdala. And as we know, amygdala is the emotion regulation center of the brain. Hippocampus is very essential in learning and memory. So this is why some people have very strong memories associated with specific smells. And then because of the activation of the limbic system, the cerebral cortex will also be activated and this is how we form thoughts and feelings and reactions when we smell them. So these are the essential oils that I'll be talking about. This is lavender and sandalwood. Both are used for calming the nervous system. There's also rose and geranium. And then we have eucalyptus, which is also for relaxation, but it is also helpful for nasal congestion. And then we have pine. This is very unique because it induces positive mood in individuals. And then we have chamomile. So chamomile is used for sleep and sedation. And then we have jasmine, which is used as an aphrodisiac. And one more very interesting essential oil is rosemary. So this is used as a cognitive stimulant. And all these are backed up by research. I hand it over to Celine. Also, we'll pass over the scented candle if you guys want to have a smell of the lavender scent.
So, talking about the evidence of aroma-based therapy, so aromatherapy was discovered accidentally by a French chemist. His name was René Morris. So he burned his hand and he accidentally put his hand in lavender, and he was shocked to see the results because after that his burned hand healed so fast, and he was the first person to term aromatherapy. So there are various benefits of aromatherapy. Lab results have shown they are useful for treating symptoms of depression, anxiety, and even for cancer patients for that matter. And essential oils are also beneficial to prevent airborne infections because they have antiviral, antiseptic, and antibacterial properties. And they can also improve libido because it has a long history of raising your energy in your body and increasing blood flow. So they are used to treat sexual dysfunctions as well. And there's an interesting fact that French soldiers who were returning from World War I, so they were given this aromatherapy to treat PTSD and pain and anxiety and depression symptoms. So these are some of the interesting facts about aromatherapy. Coming to is it safe or not, aromatherapy is mostly safe, but it can also have negative consequences. For example, it can trigger minor allergic reactions if people are not okay with the smell or they are allergic to certain essential oils. Also, you have to take caution while using aromatherapy with children and older adults because they are more sensitive to high blood pressure and epileptic seizures. So you have to take more caution while using aromatherapy with them. Other than that, aromatherapy can have various other benefits, and yeah, that's about aromatherapy.
So the next kind of alternate therapy is visualization or guided imagery. So it is a kind of focused relaxation or meditation. So basically, the person who is involved in it has to focus on a particular object or a particular experience and relax along with it. So in guided imagery, you intentionally think of a place or something that you're comfortable with, and through exercise you can relax your muscles and just keep your mind at ease. So research say that especially nature-based guided imagery interventions are especially helpful for reducing anxiety symptoms, and they are also very cost-effective and easily accessible, and I've also cited the study. So what actually happens in GI? So generally, the client will be asked to take inhale and exhale deep breaths, and while exhaling, they'll be asked to relax their muscles and give out all the stress and negative energy they've been carrying till now. So the first thing they can be asked to do is to examine the shapes, objects, and the texture around them. Let them feel the energy around them, and if they want to, if they like it, they can imagine any kind of sound or any kind of calming music that we've been playing till now. They can imagine that, but that is completely up to them. We can also ask them to imagine any kind of aroma or smell, which we have also bought here. I think lavender, mint, lemon, anything that maybe helps them. If it helps them calm them down, then that is also a possible thing that we can ask them to imagine. Lastly, we can ask them to imagine their surrounding, ask them what is all is there in the surrounding. For example, if it's a calming forest, that is a forest-based GI, we can ask them to feel what kind of environment is around them. If it's sunny or if it's raining, how does the sun feel to you? How does it feel on your face, on your body? Or if it's raining, how does that make you feel? We ask them to explain it. We ask them to describe it so that they can feel those feel those in their body. So yeah, I will Malvika goes.
Okay, so I'll be presenting on sound therapy. First of all,
Mic is not on.
Is it audible?
Yes.
Okay, so I'll be speaking about sound therapy. And first of all, I put a quote there. Everything in the universe is in a state of vibration, and different parts of our bodies can resonate with specific frequencies. So I put this here because this is like the very basic principle of sound therapy. The point is to induce a specific frequency of sound into your body, and the theory is that the vessels, the blood vessels, the veins, the muscles, the tendons, everything will react according to it.
and come.
And come to congruency with it. Ancient Tibetan cultural practices, this is where it all started. So at some point, every nation, every continent had their own form of sound therapy. China had one, Nepal had one.
Native Americans.
I'm so sorry.
It's fine, it's fine.
It keeps turning off.
Just continue.
Hello.
Hello. Yeah. So every nation had their own form of sound therapy at some point. So it is more of a cultural and spiritual roots that it has, and now it has, branched into music therapy and other forms of therapy, and it's specifically used under relaxation-based techniques. So I put it as passive and active. This is not a theoretical division as such. I put it for the understanding because passive is the one where basically the client doesn't have to do so much of work. So this is the type where you'll see, the client is having blindfolds on. They're usually in like a shavasana position, and they've got these those musical instruments around them, and the frequency is induced into them. But when it comes to the active type, the patient has to do proper work, like yoga or tai chi, and it also involves biofeedback. And one common thing that we have to understand is what is the difference between sound and music therapy. So sound therapy is just based on the frequencies, and it doesn't really focus on the... Is that very disturbing?
No, it's not.
Okay. Yeah. So sound therapy is more focused on the frequencies as such and creating bodily effects. But music therapy is more into musical theories and creating harmonies and creating effects. These are the four major types of sound therapy. So the basic one is a sound bath. This is the one that involves Tibetan single bowls, tinshas, temple bells. These are all musical instruments. It's usually paired with yoga or chanting mantra like Om. And there's usually guided sound meditation as well. So some people, they report that they're not always calm after a sound therapy session is done. They can have aggressive emotions also. So that just talks about the effects that sound can create in your body. It's very effective in meditation, sleep induction, and deep relaxation. The second is binaural beats. So basically 2 tones of different frequency is played in each ear. And the principle is that the difference between these 2 tones, that much of frequency will be induced in your brain. So maybe you can create an alpha wave or beta wave in your brain, and you'll go into that altered state of consciousness. So it's effective in creating meditative states or focus states. Then we have vibro acoustic sound therapy, which involves low frequency waves that is basically pushed through a system of transducers that is embedded in soft furniture. So you can just imagine a person sitting down in a piece of furniture, and sound waves are sort of like, pass through every part of that furniture, and it goes into your body. It's really effective in pain and muscle tension because it has an effect on your muscles. Acutonics, this is when, suppose a person who has stress points in different parts of your body, like acupuncture points or trigger points. So tuning forks will be kept nearby and then the frequency is induced. It's really good for releasing blockages or promoting blood flow. And these are just the benefits or like the outcomes. It's really good for chronic pain conditions like fibromyalgia. It balances the chakras and releases the blocked energy in your body. And it's really good in deep muscle relaxation in generalized anxiety disorder, and it's effective in sleep disorders as well.
Hi, so me, Christina, and Rhythm will be presenting on somatic therapy. So somatic therapy basically involves how our body and mind is connected. So when we talk about somatic therapy, it comes with the focus or the premise that unresolved emotional issues that can lead to physical symptoms and tensions in the body. So for example, usually when I personally get anxious, especially during exams, I have certain stomach ache or some bad stomach problems. So that is one of the examples of how trauma or emotional experiences can affect your body. So in somatic therapy, the somatic therapists, they usually focus on how clients recall these traumatic events and how they use relaxation techniques and grounding techniques to bring them back to the present. One of the somatic therapy is eye movement desensitization and reprocessing, that is EMDR. So it uses eye movements or rhythmic tapping to change the way a memory is stored in the body, and it allows you to process it. So in this, therapists, they ask the client to recall the traumatic event, and they then instruct them to do side-to-side movements. So this side-to-side movements, according to them, it directly impacts the thalamus, which may cause a certain amount of cognitive processes that allow greater control over the emotional distress. One more reason behind this is that back and forth eye movements, they may help brain consolidate memories in the same way that it does during the REM sleep. Now, Kristu.
Hello, it's Rhythm. And moving further, we'll be talking about one of the contemporary relaxation technique, that is REST, and it means restricted environmental stimulation therapy. In general terms, it is also said as flotation therapy. And how it works, it basically works by like floating comfortably on the backside of the dark and quite isolated tank, and this is tank, it's little blur here. And it is basically filled with salt water, and that is and its temperature should be maintained around 25 degrees Celsius. So it is maintained on that temperature because it helps in controlling the sensory input to the somatosensory system, and further to minimize auditory stimuli, we can use earplugs as well. And according to the recent research, it has been suggested at least 12 floating sessions are required that should be of 45 minutes over 7-week period, so as to have some sufficient therapeutic effects of this therapy. And other certain recent research also tell that it has a very promising effect in chronic pain conditions, stress-related ailments, and generalized anxiety disorder. So due to time constraint, we are able to present some limited information over, but we have found out some very relevant and interesting research articles. We'll be sharing them in the group. Thank you.
Did you guys get bored? Relax too much that you want to sleep? Okay. So my slide actually does not have too much of information as such, but I'm continuing the topic of somatic therapy. Now, how many of you guys actually meditate? One. Okay. How many of you have tried meditating? One. Okay. How many of you think meditation is effective? Quite a few. Okay. So there is one thing that one of my mentors earlier told, that practice only things that you believe in. Okay, so if you're approaching with a certain style, you should have belief in that style, that style is going to work on your clients. Okay, so when it comes to somatic therapy, relaxation based technique, when we think about it, it is all about what, calming yourself down. We always think of meditation. Now when I say that it is more than meditation, it is more about how your mind and body both integrate together. So there were two people involved in the story behind of somatic therapy, which is Dr. Peter Levine and Dr. Oden, yeah, right. So both of these people actually thought that why just mind? When we talk about relaxation, there are memories that are stored at cellular level of our body. Sometimes we see that, okay, after one flight or fight response, when we talk about generalized anxiety disorder, you don't need to trigger all this, but your body feels in a very panic state, right? So which means that calming has to happen on a cellular level of your body as well. So that is where somatic therapy comes in. And what you definitely need here is somatic awareness. Now when I talk about somatic awareness, it is about amplifying your bodily sensation. It is about feeling how you feel in every part of your body. So this is the first step you do before you start the process of using different techniques as such. You do somatic awareness for each part of the body. Okay, I feel a twitch near my eyebrow, or I feel too hot. Sometimes people just feel too hot, they're sweating, but their upper part of the body feels hot, fingers feel cold. So there are very different sensations that are associated. So you minutely note each of it during the session of somatic awareness. Okay, so these are the 5 techniques that I will be talking about. Now coming to the first one, which is resourcing. So resourcing is very similar to that of finding a comfort space, which Saundarya spoke about. Now how resourcing is different from comfort space is that you create a secure space for yourself. But it can be anything. It can be a person, it can be an experience, it can be a happy memory, it can be anything as such. Also, another important thing is that here you create 3 things. One, a nurturing figure, one, a wise figure, and one, a promising figure, protecting promising figure. So why do you create these figures is basically to reassure you at times. Now when we work as mental health professionals or therapists, our goal is clients' well-being, them to be able to cope with themselves without our intervention or much of our help, right? So they need reassurance from apart from what is happening in the session. So it is essential that they create certain figures, or at least draw certain figures that they have in their life. It can be their brother, their father, anything. If they don't have anything, then you create one so that outside the therapeutic space they can still use these techniques for their benefit. The second one is grounding in here and now. Now this is a very famous technique that we use outside somatic therapy also, and it was developed by Alexander Lowen, if I'm not wrong. And here you actually sit in here and now feeling. Now in somatic awareness we spoke about our bodily sensation. Now in grounding you attach that to a meaning. You attach that. Why is it happening to me? Why am I feeling cold? Am I anxious? Is it why I'm feeling cold? So you kind of assign meaning to your somatic experience. Why is that important? So that the client knows next time when they are feeling hot, cold, maybe it is a response to certain emotions that I have. I have something that I have not expressed probably. So it is very important for our clients or patients to know what they are themselves going through and to be able to understand them outside the therapeutic space, and it will be much effective for them to even communicate that with the professional later. Coming to the third one, descriptive language. Now descriptive language, it's like, we are just climbing one step higher. In descriptive language, you are going to explain that entire sensation that you're feeling part by part. Now 3 things: track, contact, describe. 3 things that you need to think about here. Now you track. Sometimes I feel pain here. Now it's moved a little lower, maybe a little this side, maybe a little that side. Last time I had upper back pain, this time I have lower back pain. So these are very common things that we hear, right? So in that session only, it is very possible that your pain travels from one place to another, or the sensation travels from one place to another. It can be tickling, it can be the needle thing that you feel. It can be anything, not necessarily pain. It just can be anything. But to be aware of it, to contact, track, and describe is what we tell the clients to do. And next we have co-regulation and self-regulation relaxation. Now co-regulation means that you as a patient and a therapist, both of them are included in regulating the patient's somatic experience. That is called co-regulation. Towards the end of the therapeutic session, what you do is you anchor this on some well-wisher of theirs. Okay, so they become their co-regulator. Now, when you think that the patient does not need much of co-regulation, then you go to the self-regulation part of it, where the client themselves can self-regulate what they are feeling. They don't need a co-regulator. But when we see very severe clients, they may not be able to self-regulate. So we need a co-regulator at that point. First, it might be you as a therapist, and then it might be a well-wisher of theirs. And then lastly, we have titration and pendulation, which is one of the very important techniques when it comes to somatic therapy. And in titration and pendulation, what happens is that every day we will have so many stresses around us, right? Now, coming from Christ, my daily life is stressor. So stress is very inevitable, pain is also inevitable, suffering is optional, so we are surrounded with a lot of things that we may consider as negative or we are not able to cope with it. So it is very important that the client also understands that not everything might be good, that I still need to get used to distress. So what you do in titration and pendulation is that you pendulate them from mild level of distress, and then you ask them, when they reach the point of distress, then you go back and ask them to pendulate to the safe space. How to feel happy, how to regulate yourself. Then again you take them to a point of distress, and then you again bring back to their safe space. So this is how you teach them that every time you may see a trigger, maybe it may be a trigger for life, we don't know. They just know to cope better, right? We can't eliminate the trigger out of their life. They may get triggered at 25, 50, 75, it goes on, right? But what they can do is, we can teach them to cope better. So this is one technique, titration and pendulation, that you can use. So you use just how you do with systematic desensitization. You put a threshold, that this is the level of distress that I'm going to give. You assess the environment also. So like, let's say you're working with someone who is in the army. Now, they also use a lot of somatic therapy. So army people need a higher threshold. We should equip them with a higher threshold of surviving with stresses. They have to see deaths daily, probably. So depending on the client's portfolio regarding their workspace, home, everything, we decide the threshold, and then we oscillate between a titration and pendulation. Next. Yeah, so these are some worksheets. Most of the workbooks and worksheets are patented and copyrighted, but whatever I could find, at least a screenshot. So this is what it looks like, and you as a therapist can modify a workbook or a worksheet for your clients depending on their requirements. Now, every individual is different, not necessary you have to use these. But these are certain prompts that you can, otherwise the headings at least you can use, so that they can go back, note, and bring it back to you the next session. Because it is in somatic therapy, it is very important that they stay in connect with their mind and their body. So this is not just used for anxiety. It can be used for PTSD, it can be used for mania, it can be used for so many different things. Yeah, this is pretty much it. Yeah, these are the references and resources we have used, and we have compiled sort of workbook type of thing, which we will put it in the group, and that has links which will, some are guided ways of doing these things, and some are just for better understanding by certified professionals. So you can go read and take a look. Christina.
A very good presentation, very good content, and relevant.
Thank you.
And I like the energy and the colors. It's lively. So, what could be the contraindication for relaxation therapies?
So, contraindications can be if they are not physically fit for it. So sometimes there might be certain physical restraints that people go through. And apart from it, even in psychotic symptoms, it may not be very feasible to do. Also for sound therapy, it's recommended that if you have chronic vascular conditions, it's not recommended. Heart conditions, stroke. Also pregnancy-related things.
So, one of the main contraindications for relaxation therapy would be the restlessness too. If somebody is having too much of a cognitive issues, it could not be a physical restlessness, emotional restlessness. It may not be that. Definitely psychosis, it is contraindicated. And that's a frank psychotic, you cannot. But sometimes one of the mistakes most of us do is to kind of try to relax people who are going through ruminations or having obsessive thinking or acute stresses. In an acute phase, you could not. The person will only increase the symptoms will become aggravated and it's contraindicated. I think that is something which everybody should know, that relaxation meditation is always not a universal solution for all the problems, but it is a very significant portion of our understanding. So how would you club a relaxation therapy with your ongoing other therapeutics like CBT?
Okay, so I am speaking based on sound therapy mostly because that's what I focused on. So in sound therapy, it's very similar to what we do in the biofeedback here apparently. So first you come to a baseline state, then you make them do CBT, whatever all that is, and then the yogic meditation type, and then you check their biofeedback. And based on that, you can make further modifications.
So how does this become a part of a cognitive behavior therapy, or where are we what is the interface? How are we linking it to the vicious cycle which we actually learn?
Okay, so first thing, you can approach it in two ways. So, provided that they are fit for relaxation-based therapy, if you are, let's say, going with CBT, you can alternate the sessions based on how it happens, and the workbooks are mainly how you do it. Yeah, workbooks are mainly how you practice it, and I think the one session goes for around 45 to 50 minutes, but this is found even more useful in especially in the healing phase. So CBT can be used for the initial part of it where you change or alter the schemas, but relaxation based therapy is exceptionally helpful when it comes to coping, or rather holding the client accountable for their healing. So once they reach that state, right, so it is even more useful because they'll be able to cope even outside. So after you alter or change the schema, this is especially very useful for PTSD, anxiety and sleep disorders.
What I'm asking is, how do we integrate? So what you're trying to say is the relaxation should be after when there's a healing process, or where we're not really working directly with CBT or the schema changes. What I'm trying to ask is, how do we integrate? So what is the understanding of a relaxation training, or whichever method we would use? It is for us to understand the biological nature and the physiological nature of the impact of the thought process. Whenever there is a distressing thought process, there's always a body change, and the thought is connected to body, connected to behavior. So in the process of CBT or in the process of DBT or any kind of an exposure treatment, so the relaxation would be an interface between the thought and the body and the behavior. So you kind of link it, not only look it as a healing process where we are not minimizing it to a point that is just a healing factor. No, it is not. It is going to be a midway between the thought, between the body and then action, or the other way, action, body and the thought. So if we are looking at it in that dynamics, so we are looking at relaxation as the middle ground for us to work on the thought and the behavior. So the cognitive based treatment which people are going to talk about now to the behavioral based treatment which people have dropped out, like a dynamic or a expression, the body still is relevant, relaxation still is relevant, and this entire system, whichever medium we choose to use, is relevant. So as you said, it could just be relaxation, but it could also be a part of the ongoing journey of the therapeutics.
Just adding on to what you said, especially when it comes to psychodynamic, we challenge the client. In CBT, we confront their rationals. So in such cases, the client might be in a very difficult position or situation where they're not able to deal with it. Sometimes it might go wrong, that they were not ready for the challenge or confrontation. So in such cases also you can
relaxation works. So what is the takeaway for everybody is not to look at it as an independent, minimalistic, good-looking entity. It has a deeper meaning to it when we look into a deeper therapeutics too. So that's the takeaway. So whatever medium we use, the medium is chosen based on the accessibility of the patient and also whatever facility we have. But not to minimize it just by saying it's just a JPMR. It is not just a thing. It's a thing. You know, it has got a huge meaning to it. So we have to understand the significance and the role it plays in our entire work. Okay, that's for our staff also to understand JPMR and everything plays a significant role in the application of a therapeutics. So how many of you read the book Body Has a Score? Body Keeps Its Score. I think all of you should read it. So you have mentioned it, Body Keeps Its Score. So I think it's a book based on trauma, and it is written by Bessel van der Beek, and Nizam has it, you could steal it from him. So I am planning to do it quickly. So he has been reading from 2-3 months, by the way. Yeah, still is reading. So you can take it from him. So you please read the book. It has a good amount of trauma-informed somatization problems, so we could read that, and it's a very well-renowned, and most of them use that book for somatization, by the way. And EMDR is not relaxation. EMDR is a psychoanalytical approach because we are directly reprocessing the trauma. It is absolutely not, it's eye movements, but the reprocessing the trauma, right? So it is not relaxing at all. Okay, so EMDR could be at a later point, maybe when the therapeutics are, but it comes from the psychoanalytics. It is a dynamics. So you're using the eye movement to reprocess the information in the memory, and that is absolutely not relaxing. Okay, so that's not relaxation training. It's a psychoanalytical approach, which probably comes under transactions and dynamics part. Very well thought and a good presentation. Thank you. Anybody else have any questions?
I have a question. I don't need mic. So, I see you are actually scrolling the show. So, all girls have done a wonderful job. But how was it possible for you to do the presentation without using mobile? And the rest of the girls all use mobile. It's a weird question, but I want you to answer it. It should be a learning for everyone. Do you have a mic?
I never use anything. It just distracts me from my flow. So I do have my prompts. But I think when I get into the presentation mode, I believe in altering according to what comes to my mind. Suddenly, few information may come, and looking at people, I may improvise. So I do believe in improvisation. And I think once you prepare enough, it's
So is it
okay.
because you deep down you kind of studied the subject very well?
Yeah, I mean, if I am presenting something, it's something I know.
That's good. Some people cannot, I can't. I cannot have it when we are presenting. It should be.
It actually distracts you most of
Distracts
the
you.
times.
But it does not mean that others have
No,
not
you
done a good
girls
job. All
have
have done a wonderful job.
Just said I wanted to learn from myself.
Just next
as a
step.
feedback.
Next step, yeah.
Thank you so much.
Anybody, any questions have any? Our staff, anybody has any doubt, please ask. And Sultan, do you want to add anything on relaxation? How does Ayurveda help in relaxation? We are coming up with the massage and aroma and other things. So do you want to add on? Not clinical relevance at least. How do, I mean,
Like Christina, you can say, you don't have to say
steam,
impromptu.
steam, we are coming up steam, you are going to be in charge of the department. How are we going to integrate steam, water they spoke about, and massage, aroma they spoke about. So how do you kind of see a relevance for a mental health setup like this in Ayurveda? Because we are going to integrate it, right? So we should know. You can just say how is it relevant?
Come here, Sultan. There is a recording going on. We won't post it. Come, Dr. Sultan. थोड़ा सा. Clap for Dr. Sultan. Good job, girls. Very nice.
Just for that.
Yeah.
Sorry, I can't see anything.
Now your turn is done.
Yeah, I will sit there. Yeah, I can. You sit here, I go.
I'll sit there.
No, there she wants.
Okay.
Where you want me to sit?
I sit there because I can see it.
Sit all of you in the front also. Sit Malal. Sit you also.
Yeah, Sultanji.
Yeah. Thank you, ma'am. As I'm not prepared much, ma'am, so I'll be just touching a few points on the relaxation part of in the context of Ayurveda. So in Ayurveda, there is a term called Abhyanga. Abhyanga means massage, and there are two types of Abhyanga prescribed in Ayurveda in the classical text, which is called as Ashtanga Hridaya. As Ashtanga Hridaya, that's the book which we can think as in like we think for example, we can say that for in the religious perspective, for Islam, we can say that the Quran is the heart of Islam. And for Hinduism, there are texts which are called Bhagavad Gita, Vedas like Yajurveda, Rigveda, Samaveda, Atharva Veda, like that. So in Ayurveda, that Ashtanga Hridaya is the heart of Ayurveda. So in that book, it's prescribed two types of Abhyanga, that's the massage. One is the Murta Abhyanga. Murta means head part massage. And another is the general Abhyanga, which is the general body massage. And that massage has a very great impact on relaxation part of our body. So whenever there is a patient who is suffering from, say, mental disorders, in Ayurveda actually the mental disorder has been prescribed as only in one part. It's called Unmada. Unmada means that which person who has a mental disorder or any mental illnesses. In the modern context, it has been like classified into several parts, like many types of disorders. But in Ayurveda, there is only one part which has been prescribed, and for those reasons, those illnesses, the Abhyanga helps a lot in the recovery process, and along with the oral medicines that whichever we take. So combining all these Abhyanga and that is the therapies and the oral medicines, it helps a patient to recover much earlier. So that's it, ma'am.
Nice.
So the Abhyanga, when you do, your focus is only on the body relaxation. So you're not looking at any medication or any ingestion of anything, right? It's just going to be some oil massage. What are the materials we'll use for the massage like?
Yeah. So there are different types of materials used actually. We have a body assessment system in Ayurveda called Prakriti. That is Prakriti, that is the nature of the human body. So it's divided basically into three types. One is called Vata, Pitta and Kapha. So based on that body constitution, we have to decide the material, what can be used and what cannot be used.
So that's patient specific.
Yeah, it's the patient specific and exactly, ma'am. Patient specific and the history of the patient specific.
So you will have to first take a history, understand
Yeah.
Vata, Pitta, Kapha, and then take a
Yeah. And there are different types of oils and desi cow ghees which are used in Ayurveda. For example, there are oils called Brahmi Taila and Tila Taila, that is sesame oil, and Mahanarayana Tailam. There are many types of oils used. So, and sometimes coconut water is also used, and those are all proven actually in Ayurveda. And yeah, that's it.
So at the last point, I will.
Yeah.
So our team spoke very well about aromatherapy. They spoke about the lavender, sandalwood, the thyme, and he spoke about coconut and ghee and stuff like that. So this again, from a medical perspective, we would look at it as a sensory integration, which is looking at a relaxation, which is leading to a operant conditioning in the brain, which would be helping us in a neurocognitive change. So with this, I welcome the next group who is going to talk about the cognitive therapies. Thank you, Sultan. So I'm so happy that yesterday the team stayed back till 10:30 in the night and prepared the slide. That shows the investment. So I'm looking forward for the presentation.
Just a moment.
Cognitive
Stimulation.
Yeah, I don't know. Thinking. I think just go. Just call it.
Somebody should sit here.
Yeah, I can. Can I get a mic?
Yeah. Oh, yes.
Hi, so just a moment. Okay, good morning everyone. I'm Azim. We are Group D. So my group has Sabina.
Good morning, everyone.
Good morning.
We have Darshan over here.
Good morning, everyone.
We have Chitesh and Misbah. So we are going to talk about cognitive stimulation therapy. So cognitive stimulation therapy. Is it visible? Okay. So it is a short-term non-pharmacological intervention which so I'll repeat that again. This is a short-term non-pharmacological intervention which is used to treat complex behavior and psychological symptoms seen in patients with mild to moderate dementia. So this can be done in a group setting or in an individual setting, so one-on-one sessions, or like a group setting, like a community setting. So this currently has been, the development has been taken forward by Dr. Amy Spector and her team from UK. This CST, or Cognitive Stimulation Therapy, has been recognized by National Institute of Health and Clinical Excellence by UK as an evidence-based intervention for psychological intervention for mild to moderate dementia patients or similar symptoms, people with similar symptoms. So it focuses on enhancing implicit memory in patients. Implicit memory is basically memory which you're not intentionally retaining. say you listen to songs and you're just listening to them on repeat and you recall those songs without having that intention ki I want to remember these songs. So that's implicit memory. Their focus is on enhancing the implicit memory in patients. So for the brief history, I call Darshan, so he'll be taking over.
Yeah, so I'll be talking about the history of cognitive stimulation therapy. So the development of CST, it all started in the 1970s, and it was done by, initially it was started by Robert R. Gayson. So he was the one who introduced this. So he started this cognitive stimulation to improve the cognitive functions and functionality in older adults, and especially with adults with dementia. So in the time period of 1970 to 1980s, Robert and his colleagues conducted extensive research on this, and especially on cognitive training and stimulation. So that paved the path to taking CST as a therapeutic approach. So in 2001, there was this first randomized control trial that was done on CST. So it was done by Dr. Martin Orell. So that is what it showed, the effectiveness of cognitive stimulation therapy. So since then, CST has been, it has gained worldwide recognition and adoption in many healthcare settings and many other countries in different hospital settings and other therapeutic sessions. So throughout its history, so CST has continued to evolve and adapt based on ongoing research and feedback from clinical practitioners and practices. So the main important tool, so CST has become an important tool for cognitive interventions and neurological interventions as well. So it mainly focuses on to support and to improve the cognitive functionality and quality of life among the people with dementia. So that's that. I'll be handing over to Jitesh.
Okay, I'm going to be speaking about the types of cognitive stimulation therapies and techniques. These are just a few of them. So first one is the classical workbook exercise. So this works on the cognitive functions and the capabilities such as memory, attention, problem solving, and orientation. These are available in many different levels of difficulty based on the person's age or cognitive level. So these are the examples of the books: ST, Consorces, Sanitary, Integral, and Rubio. All of these help in training people while doing exercises on the workbooks, and this helps. The ST one helps with people having mild to moderate dementia, and the CSI helps people with early stage dementia, and Rubio helps to enforce. And coming to brain training games, these are applications for cell phones, tablets, and computers that can be utilized anytime and anywhere. This is accessible for people of all ages, and these are the examples: Lumosity, Elevate, and Neuronation. There are many different levels, and this helps in the gradual progress of an individual. As you complete each level, the difficulty increases, and ensuring that there's an improvement in cognitive capabilities and executive functions. Neurotechnology, this is a fairly new method which employs producing neural plastic in brain areas, and these procedures use new technologies to record the brain activity of each person, adapting the necessary interventions to produce the desired changes in brain plasticity. And this is Elivo neurotechnology developed by BitBrain is one of the examples. Thank you.
Hello everyone. So today I'm going to speak about the brain areas that are involved in CST, and I'm also going to present you with the activity that is done during that. So which are the areas that will be involved in that? So frontal cortex,
how it will. So there are 3 levels. The CST can be used for people like dementia, Alzheimer's, and ADHD as well to improve their attention skills. Now we all know for dementia, they start losing their smell ability, like olfactory bulb is getting lower, their ability, and the 3 things are mild, moderate, and severe. So in mild, we can use activities like word association. So in word, for example, this is the patient. Okay, and I'll say the word like drink. You have to ask her what she can. Okay, the first thing you need to do is ask the memory when you have built the report. So you will know according, it will differ from the patient to patient. So you will know to help them, you will ask them something and they can tell you about it. So from that, if she used to drink orange juice every day, but now she has started to forget that. So I can ask her drink. She'll tell me juice, orange. Juice and orange. So she used to drink orange juice every day that way, or she used to like orange juice. So in here, frontal cortex, in that prefrontal cortex is helping her making the decision that she used to drink that, or as well as temporal lobe is here activated. How it is helping? There is hippocampus and Wernicke's areas present there. So hippocampus is basically helping her recall the memory, and the parietal lobe also. Parietal lobe is helping her to segregate the words, that is drink, juice, orange, that is associated together. Then in moderate, we can use activities for memory recalling. Now we can show pictures to them, old pictures, and show them objects that are similar to them. So in the activities, what you will do is matching sequences in the order. So I'll give her a tea. Now if that also depends on the person. So if it is a business person who was there, and we can help them do something that they used to do daily. Now if it's a housewife and she used to make tea daily, so I'll give her the things. I'm not sure all of you can see that, but
Sugar.
yeah, sugar, the tea that they from the cup, and you will give some extra material that can be black pepper or something, and then we don't have the things material all, so we can have an imaginary gas stove and all, and I'll ask them what things you'll pour first in the bowl and all. In the vessel, what will you pour first? Water. After the water, what will you pour in that? Sugar. Okay. Now this is the sugar, or you can keep salt, so you will know that the prefrontal cortex is working or not. That is, if they are able to differentiate between the two, as well as from parietal lobe, their visual spatial is perfect or not, so that if they are having some impairment or not, we can know through that. So this is sugar or that is sugar? This is sugar. Then she'll pour the sugar. That way we'll arrange every sequence, and then we'll ask, now they can pour directly into the cup instead of using the net. So we have to ask, do you use the net, or we'll have to observe that they will use the net or not. In such ways, these activities can be done. Now comes the severe part, where they have lost their memories ability a lot, or some patients, they come after they have reached the severe stages. So for that, the aromatherapy, that is how we relate here. Sensory stimulation is given to them, so that the aromatherapy, the smell or something, to keep them in touch with it. They will lose the feeling of, so Alzheimer people, they will lose the feeling of touch sensations and cold sensation, all of it. So this will help them to be in touch with that reality and that surrounding. Now I'll explain the functions of the frontal cortex. That is, in the prefrontal cortex, it will help them for decision making and the execution of the decision making that they have made, as well as the Broca's area, which is responsible for the speech production and all, that way. Hippocampus for the memory recalling, even though that is the area that is damaged here the most. So we'll help them through these activities to recall some of it. Basal ganglia, so if I've done this activity, the coordination of the muscle movement is also need to be seen through this. Parietal lobe for the processing of and association of the words, and the things they are saying is making sense or not to the words we are saying them. Are they able to relate it or not? Temporal lobe, the hippocampus, and the Wernicke's area, so that they are understanding the speech or not. Default mode network. So here DMN is doing what? It is active in the rest and self-referential thoughts. Here it will alter, the CST is seen to alter it, and they are getting more active in concentration and attention. And amygdala, for the things that we are saying. Now we ask the history, and according to that we are doing the activities. Hence the emotion they are able to relate through it. So all these areas are helping in CST with the patient, and this therapy is held that way. Even though we are, for us it will be very normal, but for them we can see in the MRI scans that there is activation in those areas. It will light up in the MRI scans. There are activations because we are making them do this therapy. So that are the brain areas that can be seen. Now I'll pass it to Mispa.
So the benefits of CST, it improves the cognitive abilities. While we engage the clients in doing cognitive activities or mental stimulation, it helps them keep the brain active and challenged. This can lead to the preservation of cognitive skills such as memory, attention, language, problem solving skills, and decision makings. Enhance social interaction. CST mainly focus on group therapy. So when the clients are doing engaging with other people in group therapies and all, it can help boost their self-esteem and self-confidence. Increased confidence and self-esteem. While we engage them in cognitive activities, it might make them feel like, yes, I am achieving something while engaging in cognitive activities, yes, I have done something. So it might help them increase in confidence and self-esteem. Delayed cognitive decline. CST may not resolve cognitive decline. Research suggests that it can help slow down its progression by providing continuous cognitive challenges and mental stimulation. CST helps maintain neural connections and brain plasticity, which are crucial for healthy cognitive functions.
Okay. So now I'll explain few things that are like for CST when we are doing it. How is it helping? So for IPD patients, now we see they're mostly in their room, and dementia people, they are not socially active and all. They are just laying in their room, getting bored and all. That is not making them happen their day-to-day functioning. So this activity can also be reward processing when we are doing in group or individually. So when we are doing in group, we can do like things like, if it's a theme based and it is 14 sessions, or it can be more, and usually done twice a week. So what we can do is, you call them everyone out and you make them play, interact according to the theme. And what you do is, when you choose a theme, first it will be chosen by you. Then later, what you can do is that whoever wins, that person will choose the theme according to them. So it will help them, motivate them through this therapy to come out of their room and play with everyone and socially interact with everyone. This will improve their ability to socially interact, as in dementia it gets lower and lower. So this therapy is going to help them in all of those ways. Thank you. Also with psychiatrists, if we are doing this, so it can help like if you are doing acetylcholine treatment with CST, it is seen more in the researches, it has been more beneficial, as acetylcholine is the one who is helping them repair their memories, like connect the networks and pass the memory, the messages. So it will help them that way. Thank you.
Good job. I think it is donepezil, not acetylcholine.
Sorry?
It is donepezil, the cognitive enhancer. Acetylcholine is one of the neurotransmitters, but the donepezil is one of the cognitive enhancers which is used. Acetylcholine is still relevant. Yeah. So does the management plan it be the same for all the patients?
No, it will vary from the patient to patient.
How do you differentiate between two patients?
Okay, so if I can take the example from the first. Okay. So Nyanendra is a patient who has severe depression, and he is mostly sleeping whole day. And you take Aziz, even though he's in his room, but he's active. And Jnanendra is not. So for Aziz, no, not Aziz I'll take Hafsa. She was very hyperly active. So we have to calm her down as she has hypermania. So for her, we need to calm her down, relax her down, and see that if she's able to, do things without talking too much. So we are engage her in activity like drawing, painting, do that something that don't require that much talking to give her brain a little bit of peace, and stability. And for Jnanendra, we need to engage in activities where he's talking, because he's not talking, he's usually sleeping, or he'll just ignore whatever you're saying. So we'll engage him in activities that involve more of counseling, I guess, and things we are asking him constantly. That way we can differentiate between two patients depending on their diagnosis.
No, I'm not asking about that.
Sorry.
What I'm asking is, if at all you're looking at CST alone,
Okay.
how would, and if you're looking at lobe functioning, and how would you kind of choose which lobe are you kind of choosing to, like, we are now talking about dementia patients, right? Now if you're looking at two dementia patients, how will you choose the intervention plan differently? So that, like, Jnanendra and Hafsa are two different diagnoses.
Yeah.
So that is clear. Okay. But then if two dementia patients are there, then how will you differentiate the interventional plan for both?
I think we can do that based on the severity levels of the patients between those two, and we can plan things accordingly. From is it mild to severe, or is it lower than that, or do we need excessive treatment?
Assessments comes into picture here.
Yeah,
so we will have
yeah.
to look into assessments,
Yes.
like the Luria and other things. You should probably tell us which is the dominant, which are the areas of the, like how you explain, beautifully you have explained how sequencing happens, planning happens, frontal lobe activation happens, and then how the chaining happens. All that we could do based on assessment. That's where the assessment comes into picture. So depending upon the assessmental scores, we could then plan accordingly. For theoretic purpose, like whatever activity we do is different, but then if you're looking at the intervention strategy. So how do you think the prognosis changes with intervention? Do you have any numbers to say? How does the prognosis change with intervention, without intervention? Does the prognosis change, by the way?
I don't think so.
Then why are you doing it?
I mean, there are still, research going on till today.
Yeah, CST is not completely now in the picture because it's mostly done in UK.
Why
and
would you then do
research.
it? I mean, if at all it's not changing the prognosis, why are we doing it? What is the intent behind it?
They are still seeing actually the activities that the brain cognitive functions are increasing or not through it, or it is helping. Although it is seen that CST is helping the patient in some of the cognitive abilities rather than going completely low.
You have already answered the question in the thing actually. You have already answered. Reward mechanism, social interaction, self-esteem building, confidence. We are really not looking at prognosis because we already know prognosis is bad. Then why are we doing it? I mean, we'll leave it alone, right? But we cannot because there is a reward mechanism. There is a good amount of excitation which happens. There is a good amount of adrenaline stimulation happening.
Increase of dopamine.
Yes, the exciting. So it may not have direct impact on the prognosis, but we are looking at the improvement of quality of life. Right? So the intent behind the intervention would not be changing the prognostic lines, but look at the quality of life. The more the quality of life is better, the better our ADLs, the better our, and anyway they are reaching death, but then we can kind of do it better. So that is the whole idea of CST.
That is also with acetylcholine, no? It is like the hyperactive neurotransmitters, the excited.
So we are kind of tweaking the neuroplasticity and the neurochemicals rather than cognitive ability per se.
Yes.
Because this is a degenerative disorder.
Yeah.
So you're against the wind already, right? You're already under a degenerative process. We are not going to any magic. But we are working on whatever available resource of neurochemicals are available. We are trying to excite it as much as possible. That would be the intent with which we plan an intervention.
Yeah.
Okay? So do you think there is an application of the same thing in any of the other psychiatric diagnoses?
I think, ma'am, it's, I mean, for CST, it's mainly non-pharmacological because medicines are not mainly used in the mainstream line because this is mainly focused on group therapies. Like, it is more on the
The
psychological
whole
side.
idea of CST is to be
Yeah.
non-pharmacological intervention that way.
It could be used in schizophrenia. Schizophrenia and bipolar.
Bipolar, yes.
It could be used in all of our long-term cases.
Depending on the cases, we can
When the
use
burden
this.
of the illness is high,
Yeah.
and the cognitive decline is high, we could still use CST for our rehabilitation cases as well, like Ramesh, like Vijay Lakshmi. All of them will definitely benefit from a stimulatory technique. Good presentation. Anybody else has a doubt?
I have a question, ma'am.
Yes.
So, cognitive stimulation therapy is recommended for people suffering from dementia, right?
Yeah.
Basically, that is what I understood from your short presentation. So, you've given an example of preparing tea, first what you'll put and then next what. So, if someone's pattern got changes, like for example, for me, I'll put water, then not sugar, I'll put tea. And the tea leaves.
That is okay. No, depends on how
Can it
the
be-
person used to make
Can
it.
it be considered
Yeah, it is,
dementia?
it is. No, that is okay.
This question is
Okay. That I also thought later of it.
Later on you talk.
Yeah.
No. I think I'll get it. Give me the picture.
So it is not about the sequence, it is about the understanding, comprehension. Now, in the example given, if the client chooses black pepper instead of sugar, it is not the order which is important, it's about the choices. Whether you had a comprehension to understand I need to use sugar and not black pepper, that's why the black pepper is kept there. So that we confuse the person, and if that person made a decision of sugar but not black pepper, that means the discrimination ability was good. So it's not about the order, it's about the choices and the intent and the end goal. Now for example, we may give some article and just see how the person uses it. Now, like a pen. A person with dementia can forget how to use a pen. When you give a pen to their hand, they start eating it. Or, they could start poking somebody with it. So, the ability is for comprehension and discrimination and the application rather than the order per se.
That is where parietal lobe and prefrontal
Frontal lobe comes into picture. Yeah.
The most beautiful thing about you guys is you have not got anything from your houses. That is good. Out of scarcity, you saw the things here in the office and you kind of made a demo out of it. Wonderful.
That's what we need. That's also cognitive ability of creativity, ideas, and knowledge. By the way. That's the theme of today's talk.
How you are using things.
Yeah, very good.
And the fact that they could actually do this last minute thing.
Yeah,
we covered the
exactly.
topic.
We had it in mind, we were like, we'll go, we'll get it, we don't have it.
They did not cover the topic.
Very
So
nice,
they
very
just
nice.
take it.
So I wanted to take this opportunity. I have seen Shabina, right? Shabina, I have seen in IPD. See, I have been giving you schedules, right? So, for example, I have 3 girls for IPD. Most of the times, they will bunk. And this girl, trust me, I don't know, like how she gets this energy. She has been involved with patients. I mean, extremely involved. Whenever I have been to IP, this is the only girl. I don't know, like, she's not getting any money. There is no rewards, but out of her own willingness, she's been. I've seen her. Yeah, she's the only girl.
Yeah, and Darshan also, Mispa, all of them, because patients named them, especially Jnanendra and all have named them. Very good involvement and initiation. We are happy. That's how you learn. Your brain also gets stimulated. So thank you so much. I think now our judge can speak about expressive therapy.
Honestly, I hope I can keep guys because you've done a phenomenal job. But I might need I don't need a mic, I need a PPT connector.
Pinky,
Like projector, please.
you should send it to the name to this one. Sorry, connected.
Just give an understanding of what it is and then you can find out.
Hey, ask these girls to come back now. Otherwise, what is the point of presenting?
They didn't come, it would not be possible.
Okay, this is not good. This is not fitting.
Pinky.
The other side also. It's not. I just need it to present the case studies.
You don't have that.
You know what I can do? So I need it for the case studies.
Or just present with them.
Can you?
But I need it for the case
Can
study.
you send it to Pinky?
I can send it to Pinky, but I need it today.
There's no slot.
I need it for the case study, ma'am. Otherwise, I can present everything else.
Ma'am, there's this Gmail ID.
You can send it to that.
Fida, she went with some.
Yeah.
Pinky, she doesn't have the slot. She sends it to you?
Yeah, send me.
Send it.
Email.
Give me your email ID.
Email, MNBH.
No, it's in my laptop. How do I send it? If I need hotspot something.
You can send it to the email.
Give me hotspot or something.
You're not presenting. Small college of see, they avoided it. You should appreciate their guts. So the moment they accepted it, it means a lot. The rest of the guys they not receive it. Stays there, na?
Not only that, they want to work also. They want to work.
It's on its own.
What is the password for your hotspot?
Let's see. Nice one. It's a nice thing. So we'll
Hello? Zoya, can you please come to the counter? Zoya. What's the called? Reshma. Okay, Reshma.
I know Reshma only. Dear, I need dinner. You don't tell.
We will give winner for both. We will give winner for both.
Okay, so their guts.
Yeah. And for the Okay.
Pinky. Yeah, what do you do like to get it on screen?
Pinky, Pinky, it's here. Pinky, ये photos ले लेना.
A big thank you to Zoya for arranging with so much of enthusiasm.
Yeah, and that too in short notice.
Yes, yes, and very well done. Thank you so much.
सबने help किया है.
We won an Oscar.
I know. I'll give you a special gift.
सबने help किया है.
शाम को 7 बजे निकलना वही गिफ्ट है. नहीं, I think you have to do some windows and something. That's what they have to do.
For the teacher.
It's coming, it's coming, it's coming. Okay. Present your something. Can you let me change the slides? Start the slideshow. Okay, sorry, can you please keep up with me just for 5 minutes? I'm going to rush through this as if I've never rushed through something in my life before. Okay, I'm going to be talking about expressive therapy. Now, expressive therapy is mainly known as expressive art therapy, but art doesn't necessarily mean paper, pencil art, although that is the medium that is commonly used. Expressive therapy can be in many forms. It is a multimodal approach, and when I say multimodal, because it uses different forms of art like art, sculptures, drawing, paper, pencil, dance, music, movement, any kind of physical movement, and even play therapy comes under expressive therapy. And usually it is a trained psychologist or someone who has completed a master's in postdoctoral, master's in psychology and other qualified subject. They usually are the ones who are mediating the therapy for the clients. Can you guys read this? Can everyone read this? I'm going to rush through this. You read, no? Okay, so art uses drawing, painting, sculpting. Dance and music uses dance, music, physical movement. Writing involves fictional writing, short stories, writing of certain episodes, journaling. And play therapy also means centering the therapy, the art or the therapy in the form of play to engage the child, but to be honest, it can be used for adults as well. What does all of this have in common? No. Okay. What does all of this have in common?
Engagement.
Engagement, yes. Expression. The point of this therapy is to make sure that you don't have to use your words through talk therapy alone, because it's not possible for all of the clients or the patients to actually engage in one-to-one talk therapy with the therapist, or at least from the beginning. This can be because of developmental issues or developmental problems. This can be a result of trauma. This can be a result of shock. This is a form of therapy that is used to connect with the client, the patient, find out their current psychological condition. Is a form of using it in mental status examination to, without the client or the patient actually having to tell what is the current issue. Next one. The purpose of this form of therapy is to work through uncomfortable thoughts, feelings, and experiences without having to vocally tell it to the client, tell it to the therapist if they are not able to. Next one. Can you tell me what you see when you look at this? Because this is going to be interesting later. Tell me what you see.
Child drawing.
Child's drawing, yes. One person is sad and one person is happy.
Anything else? I'll quickly cover this.
One is dysmorphic.
One is dysmorphic. Okay. We're coming to this later. Next slide, please. There are different forms of clinical approaches to expressive therapy, but the most three fundamentals that is usually covered is humanistic approach, which follows the Rogerian principles, and it usually centers the therapy around play. It is a non-judgmental approach and it follows an even pace. Unlike CBT, which is actually used where the therapist centers certain questions to the client and the client draws or depicts the art through the questions mediated by the therapist. The humanistic approach can be useful for aggression, grief, depression, but the CBT approach, because we are centering, we are mediating with specific questions, this is very useful for post-traumatic stress disorder and basically treating the self-talk of the clients and the thoughts of the clients through the form of art. Next one. Freudian principle is actually an interesting one, where the therapist will be given, where the therapist gives the client a pen with either blue or black ink, and the client is asked to scribble, and then find a meaning in the image as the client or patient scribbles through it. And this is usually useful to treat personality and mood disorders. If the patient does not have the capacity to speak at that moment, basically loss of capacity of thought. Next one. This is a case study. This is a case study of a 40-year-old woman. So she came to the therapist with depression, and the therapist asked her to prepare a list of self-talks, 2 lists of self-talks, and then mediate and then draw a picture of it. Basically, this picture seems quite normal in first sight, but this is actually the center of her depression, because she, although appears to have the perfect life on paper, she was depressed because when she had to when she became a mother of 2 kids, she was forced to give up on her music, but on paper she has a supportive husband, in good finances, 2 children, technically nothing to cry about, but she found herself depressed. And through this, the therapist asked her to walk through like what thoughts were depressive about her life and depressive about herself. So she always felt guilty for feeling depressed, but she couldn't understand why she was feeling guilty. And this was a form of using storytelling through pictorial representation. Next
How
one.
is the picture talking about depression?
Ma'am, basically what happened was she came with depression. So she was not able, she was feeling guilty about feeling depressed. So she presented 2 lists of negative self-talk. And then the therapist asked her to prepare the drawing based on the list that she was presenting. So this is, sorry, previous slide please. This is basically how she is supposed to be, but the piano behind her is basically her passion for music, which she was forced to give up on. And because she was forced to give up on, she didn't feel like herself. And that distortion, that basically the piano or whatever, it represents her distorted self at that moment. Next slide, please. So she's supposed to be the perfect housewife. She was not being the perfect housewife, and she felt guilt about that and engaged in negative self-talk. And this was her representation of how the negative self-talk, how she felt about the negative self-talk and how the negative self-talk was consuming her. Next one. Okay. So this is the case study. This is the case study of Johnny. He was a 10-year-old when his sister was brutally murdered by a serial killer, and apparently the serial killer broke into the house when his sister and her boyfriend was there. The boyfriend was tied up, so he couldn't really help the sister. And Johnny, even though he was not there at the scene, he because of the close connection to the victim, he experienced second-hand trauma and was actually seemed to experience all the symptoms of PTSD, even though he did not witness the murder itself. So this was his drawing when he last saw his sister. Next slide. This was his drawing before his sister was murdered. This was his drawing after his sister was murdered. Now you will notice that there's a difference between his drawing between before his sister was murdered and after his sister was murdered. Can you come back to the previous slide? He seems like a normal 10-year-old boy here. Next slide. But he is presenting himself as a grown, more powerful man. That's because he saw the killer at court, and he felt that the killer was going to come after his family next. So he wanted to feel powerful, where he could take on the killer, and thus wanted to depict himself as a powerful person. This was his drawing of how he imagined his sister was getting murdered. And this was his drawing about how he felt, how his pain felt post his sister's murder. So he was not able to talk when the therapist brought him in for 5 months. And after 5 months he broke down. He couldn't talk, he was 10. And through art, he depicted various forms of the event, some where he wasn't there, some because of his emotional states. And that's how the therapist kind of continued with his treatment, and of course the investigation as well. This is art therapy in the form of trauma response, and it is also useful for forensic investigations. If anyone wants to know a little bit about the art therapy, then I recommend the reference in red. It's a handbook about different types of expressive therapy with different types of clinical approach, with assessments and many case studies.
Yes, sir.
Yes, ma'am. That's it. Sorry. This is by Cynthia, handbook of art therapy, and it's by Melacoides CA. I have it. If you want, I can send it to you. Thank you.
Thank you.
Very good.
Very good. I did this picture.
So thank you all for such a good participation, very meaningful session. It was a good learning for us too. So who is the winner? Who you think is the winner? Dr. Sultan, of course, he steals the show, but who else? In two groups, who do you think you have done well? So I think both of you have done a wonderful job, so both are declared as winners. Other two groups will be punished for not participating. So who will distribute the prizes?
Magita ma'am can do the honors.
So we can call out the names. This is for poem.
Thank you. This is like my heart.
You should have asked open by your feedback.
No, thank you.
So can, how do we call, I mean names we don't have, no?
Group A, Group 2.
Group A. No, how many of you in Group A, by the way?
7.
7 and Group B?
5.
5? So another 2 we can get it tomorrow. 10 we have.
Okay.
So 2 will give another
So
gift.
Christina and Shabina should not get it today.
Yeah, so Christina and Shabina will get a special gift separately. Okay, so I'll call, I don't know the names, if I can call out the names. Do you have the list of names, please?
You know the names, huh?
You come and call out the names and...
Come on,
Pinky?
Pinky.
She's there.
Okay, come.
Pinky?
Pinky, photos for the gifts. Photos. Take photos. Swapna, come here. Okay. Yeah, start. This video.
Selena.
Selena, wonderful job.
You did a wonderful job. All the best.
Thank you.
Rhythm.
Rhythm.
Nice name.
Sound therapy.
Rhythm,
Music.
yeah, it goes on
You should
your
have
name.
taken music therapy. Good
yeah.
job, wonderful.
Confident.
Don't try to pronounce her name.
Soundarya.
Good teamwork.
Surabhi.
In a short span of time, you all did wonderful job.